According to Kavalans, a CNN writer, in her 2010 article, about 20% of the U.S. population lives in rural areas and only 9% of doctors practice there. This is really a significant problem in the state of Kentucky because 41.6% of the population, or almost half, lives in these rural areas, according to the 2010 census. As seen on the state of Kentucky map, with the underserved counties shown in red, these counties are located mainly on the Appalachian area and in western Kentucky, and these are mainly rural areas. Those living in these rural areas experience difficulties like long waits in doctors' offices or having to travel to specialty care doctors because the care that they need isn't in their immediate reach. This is of specific importance to me as one who is going into the medical field in the future, but right now there are various reasons, including the Affordable Care Act, doctor salaries, and job placement, that there are not enough healthcare professionals to administer care to those who need it, especially those living in rural areas. I will now speak about one major cause for the insufficient amount of doctors on a really larger scale, and then I will talk about two major causes specifically in rural areas for the low amount of doctors. The first cause I would like to address is that the Affordable Care Act is allowing more people to receive health care than ever before. And if more people are seeking this health care, there has to be more doctors to counter the increasing amount of patients. Before the Affordable Care Act was implemented, there were approximately 48 million uninsured people living in the United States, according to Christensen, a CNN journalist, in her 2013 article. This map of Kentucky shows the percentage of people that were uninsured per county in 2010. The red and orange areas have the highest proportion of uninsured people. Most of these people will now be eligible for health care under the Affordable Care Act. And notice that the orange and red counties are mainly in the Appalachian area, which is mostly rural and underserved, as we saw in the previous map. Christensen also mentions in the same article that when Massachusetts began mandating health care in 2006, wait times in primary care physicians' offices increased across the board, and they never really decreased since that time. And this is really astounding because Massachusetts has the second highest patient-to-doctor ratio in all of America. And when people cannot get the sufficient care they need in primary care offices, they tend to go to emergency rooms for things like colds and flus, which aren't real emergencies, and they take away from the care and increase wait times for the real emergencies going into the emergency rooms because here nobody can be turned away. As a part of the Affordable Care Act, the state of Kentucky specifically chose to expand the number of people who are eligible for Medicaid, provide health coverage for those who retired early, extend coverage for young adults, and offer affordable insurance for those with pre-existing conditions, as listed on whitehouse.gov. So they're really covering a broad amount of people with this new act. Which really leads me into the second cause that I would like to address, and that is that the pay for doctors in rural areas is much less than it is closer to cities. And even though doctors are known to make enough money, they also acquire a lot of debt while in school because they have to go to school for an extended period of time, and everybody has to be able to pay off their college debts. Kavalans states in her 2010 CNN article that Medicaid and Medicare plans typically pay doctors significantly less than privately owned insurance companies for the same exact service. And those covered by Medicare and Medicaid typically reside in rural areas more often than in the cities. This difference in revenue can be seen by this graph showing the income of 4 hospitals, 2 in large cities in Kentucky and 2 in rural areas. The data was taken from a Foundation for a Healthy Kentucky's website and reflects 2008 facts. And it shows that while the University of Kentucky Hospital is bringing in almost $1.5 billion in revenue, and the University of Louisville is bringing in almost $2 billion in revenue, Baptist Regional Medical Center in Corbin and Muhlenberg Community Hospital in Greenville do not even make a fourth of that, with about $350 million and $83 million respectively. And while this data doesn't show exactly what doctors make, it can be assumed that they make much less in rural areas because they have to cover the same expenses both in rural and urban areas. And they also have to split the revenue amongst their different healthcare professionals for their salaries. In Kentucky, more people will be eligible for these programs under the Affordable Care Act, and it's kind of too early in the implementation process to see if government-funded insurance will pay doctors just as much as the privately owned insurance companies do. In Doctors Starved, America's Heartland in Crisis, published in 2010 in CNN, Kavalans states that a major concern for young doctors pursuing careers in rural areas in the medical field is the costs and hassles tied to insurance, and these are the insurances that cover malpractice of doctors. And there are fewer companies to cover this insurance for malpractice located in the rural areas than in the larger cities, and the cost of this insurance is increasing rapidly. So even though they're making less, they still have to pay a lot to cover themselves for this insurance. And some people don't want to work in rural areas, but there's also some people that have never even considered this, and that leads me to the third cause that I would like to address, and that is that medical school graduates work near the schools from which they graduate from more than they branch out to the surrounding areas, as Ofri, a writer and editor of the New York Times, states in her article published this past January. Most medical schools are located in major cities close to big universities, causing students to rarely even consider working in rural areas. In a 2010 CNN article, Kavlin says that less people living in rural areas and seeking an education are applying to medical school. So this really creates less doctors coming back to their roots in their hometowns to work in the future. And those that do apply to medical school have absolutely no intention of going back to their hometowns to practice medicine. According to the Association of American Medical Colleges on their website, there are only 2 universities in the whole state of Kentucky where an MD, PhD can be obtained, and these are located in Lexington and Louisville, and most people know these are really major cities in the state, and they already have many doctors. These cities are located near white areas on the underserved map of Kentucky, showing that they are already receiving proper care. And while the counties themselves might be pink, these cities themselves have so many doctors' offices and hospitals that they really don't need any more within their city limits. According to the University of Kentucky College of Medicine website and the University of Louisville School of Medicine website, both of these medical schools work with specific hospitals near campus, and students already kind of have their foot in their door there because the doctors know their faces and they know their capabilities, and that's really important when you're trying to seek any career. Also stated on the University of Kentucky College of Medicine website is that about 22% of graduates opted to stay within the UK healthcare system for their residencies in 2013, and this really makes up a large portion of the class. And there are also hospitals outside the UK healthcare system, but still in Lexington, that students chose to pursue those careers. So those are 3 of the many factors that influence the lack of desire for doctors to practice in rural settings. But according to the University of Kentucky College of Medicine website, they currently have a program that is paired with Morehead State University, and this program's purpose is to expose the rural physician career to students and help place graduates in hospitals around the Morehead area. And while this is a step in the right direction, only one of the many undeserved rural counties are affected by this program, so more programs should be implemented with other counties and the medical schools in Kentucky in order for medical school graduates to consider working in these areas. And those that do work in rural areas should be getting paid just as much for doing so as they would in cities. But the important thing is that something can be done in order to provide adequate health care so that those living in rural areas are living long, fulfilling lives.